Dr. Wang, we talked
Yes.
about missing teeth and
Yes.
and how they can create headaches and tensions and all kinds of stuff, neck pain, and obviously for chewing purposes, causing the chest problem. Good. Okay. Let's assume, and you did mention that saving them is the best way to do it, but let's assume that didn't happen. Tooth is missing. What are the ways of replacing it? What exists out there? I mean, we know there are crowns and bridges and that type of stuff. And tell us a little bit when one or the other one methods of replacing a missing tooth might be better.
Okay. Generally there's three basic options of replacing teeth. Number one is a partial denture. This is good for patients that have multiple missing teeth. So whether the advantage of the denture is when they do have multiple missing teeth, it costs the same whether you're missing one tooth or whether you're missing 10 teeth. The partial is still the same price. So I would definitely recommend the partial when you have multiple missing teeth. Option number two would be a fixed bridge. The advantage of a fixed bridge is that the fixed bridge pretty much acts and looks and feels like real teeth. You can get pretty good biting forces with the bridge. The disadvantage of the bridge is you have to make some alterations to adjacent teeth. So let's say your adjacent teeth is a good tooth. It doesn't have any cavities or any fillings. You still have to make some alterations to that tooth. And so, in effect, you're altering a good tooth. So that's the disadvantage of the bridge. The very best option is probably the dental implants.
I see. So you started, when you said option number one, that wasn't the best option. That was the last option. And then you went to the slightly better one, which is a fixed bridge. And now you're going to the best one, number three, which is...
should I do it backwards?
When? No, it's okay.
No.
It's totally okay. Just, because you said number one option, so I at the beginning I thought that was the better one, the most, solid option. So it looks to me that is maybe the most inexpensive option, because you did mention it doesn't matter how many teeth you have to replace. But those teeth come out and they're not as solid, so you can't quite eat a spare rib or an apple with it, I guess, with the partial denture.
That's right.
Okay. With the bridge,
right.
With the bridge, however, you could, right?
Yeah, you can. Yeah.
Okay.
The bridge is pretty good too.
Okay.
But implants the best.
Okay. Tell us why.
Implants. Implants. The reason why it's the best is because let's say you're missing just one tooth, you're simply just replacing that one missing tooth with a dental implant. You're not affecting the adjacent teeth, and also, let's say you get a cavity in one of the adjacent teeth. If you had a bridge, you'd have to redo the whole bridge, whereas if you had an implant, you only have to fix the tooth that's broken.
I see. Yes. So obviously that makes sense. Also, I have heard that when you have a bridge, let's say 3 units, one tooth missing, that's what we kind of talk about now. So you have 3 teeth together, but they're almost kind of like welded together. They're basically one piece. So it's like one big tooth. Shaped like 3 teeth, but nevertheless one big tooth. And so it's much, much more difficult to apparently clean and floss it. Now, for a little slappy guy like me, that may be a problem. For my wife, no. She's dedicated. She would floss it and put the thread below it, and she would do everything needed for as long as it takes. But me, I probably would get gum disease a little easier in that area, simply because I would every so often neglect to go through that ritual.
That's true. Flossing is definitely more time consuming, and you have to, spend a lot more time and be more meticulous in trying to clean out, all the food that gets trapped underneath the bridge. You can't floss through the bridge because it's one solid piece, so you have to use a floss threader to get under it and then kind of work your way around it. An implant pretty much acts and feels and flosses like a real tooth.
Okay. And in terms of, but it's still possible. If a person does get a crown, a bridge, he can still do it. He just needs to know he needs to be a little dedicated, right?
That's right.
Okay.
That's right.
Now, in terms of lasting, are there do you personally have made observation, or is there any data out there? Does a bridge last as long or almost as long or half than an implant? Is there data out there about how long each one lasts?
Well, in general, I think if you take good care of either
you're probably too young to have an implant seen failing, and maybe even too young to have a crown seen failing, right?
No, I've seen some fail. Definitely seen some fail. I think in general that the implant's going to last longer because it's easier to clean, and the implant's made out of titanium. It doesn't get a cavity.
Titanium is the same material that make the hip implants and that type of stuff, right?
That's correct. It's a very high grade medical metal. And
yeah.
It doesn't get cavities. It stays in pretty much forever. The only way for the implant to fail is if you have infection around that area and the implant comes out.
Mm-hmm. That's a matter of being good enough when you put it in to avoid that. Once that is over, there's no more real risk, right?
That's right. For a majority of patients that are healthy, the implants, most of them are, I'd say, 98, 99% successful.
Okay. Now, what about, let's just say you have that tooth missing, but one or both of the adjacent tooth, as you call it, the teeth next to it, they already are damaged also. They have some big fillings in it or some cavities going on. Then what? Would then still an implant be better? Or is then a bridge more suitable? What's the deal there?
Well, if you have adjacent teeth that need work, then if you get a bridge, it's more economical, but still the implant would still be better and more superior just based on the fact that they're going to be separate units. You're going to be able to floss between each tooth. You're going to be able to clean them a little bit easier. And if you had problems with one of the adjacent teeth, you can simply fix that adjacent tooth instead of taking off the whole bridge and having to redo the whole bridge.
That sounds a little bit like a few years ago I did this very, very smart thing, and I bought a fax machine, printer, copier, scanner. Yeah, I think it was 4-in-1 they called it. All in one. Beautiful little machine, and in terms of price, of course, it was wonderful. It's just one problem. Every time one of them doesn't work, the whole damn machine doesn't work. And you have nothing anymore. Well, I don't do that anymore now. So now I have those things separated so that, if, as you just said with the tooth, if one breaks down, you fix that one and not again fix the whole thing. Well, that makes lots of sense. Well, all right, here you have it. Anything else people should know about, so to say, replacing their teeth?
I always tell my patients when you have a tooth that's non-restorable and you need to take the tooth out, it's much better if you spend a little bit of money now to try to replace that tooth instead of waiting and maybe having to spend even more money later if you wanted to fix it at a later time. The reason why is sometimes maybe you're not sure if you want to spend that much money, and you think, maybe I'll just wait a few years before I actually do it. By that time, let's say you waited 2-3 years, you're going to have all these teeth that are kind of tipped over, and in order to replace that missing tooth at that time, it's still possible, but definitely got to spend more money because now those tipped tooth probably require maybe root canals in order to be able to straighten them back out.
And as you mentioned before, maybe it throws off your bite and you get little headaches, little that. They don't have to be super severe migraines, but any little headache isn't comfortable, and any little shoulder and neck pain isn't comfortable, and all that stuff. And there's also the fact that I guess once a tooth is missing, once the root of the bone is out, it looks like that the bone goes and say, well, my only purpose was to keep in a tooth. No more tooth, I can disappear. And just like when we lay in a hospital with a broken arm or the arm in the cast, it gets weak and thin. And so the bone disappears there. So after a few years, it may be more difficult to put an implant in it. And you might even get, if there's several teeth missing, you might even get a fallen-in cheek, which is start looking like a dried-out tomato and 100 years older than you really are. Is that a point as well?
Yeah, that's definitely true. I always emphasize that, especially to some of the ladies that really care about how they look. You get this sunken-in cheek right on the side, or if it's in the front where the tooth is going to be missing, it's definitely going to be sunken in. So I tell them, you're too young to be looking like a 80-year-old grandma when, if the patient's only like 30 years old.
Right.
I definitely encourage them to replace those teeth.
Well, I don't think it matters really how old we are. Like, here I am 59 and I don't mind looking 59. I don't even mind looking 60 or 63 or 4, but I probably would do something about it, and it would probably bother me a little bit if people think and walk up to me and say, oh, you're 70, right? I would probably go, I don't know, I like that. So we don't really mind looking our age, most of us, at a certain age anyway, but we surely mind looking older than we are, and I have definitely seen and heard. I mean, the face, they don't call it $1 million smile for nothing. It ruins it. It makes you looking very old, and that's why our grandparents did look so old, because they didn't have implants, so the bones started disappearing, and they started looking like that. Well, all right. Thank you very much. Let's talk something else, but this was very informative. So even if the teeth on the side are not so in good shape, an implant still probably is better, even though slightly more expensive on a long run, because you keep it separated, and probably eventually you'll catch up anyway, because one falls and you have to fix so much again. Thank you very much.
Thank you very